Welcome and good morning. Welcome to the National Health and Climate Forum. Thank you so much, all of you, for joining us today. So this is a national gathering of public health leaders, frontline clinicians, researchers, educators, and activists. So we're here today to listen, to learn from each other, to hear from our national experts and speakers, and to hear back from you so we can inform all of our programming and make sure that we're driving out resources that help advance climate solutions, accelerate the work that you're doing, and amplify it to a higher level. So my name is Fulgencio-Turner. I use he, him pronouns. I'm a Caucasian man, blonde, wearing glasses and a blue suit. And we are gathering here today on the unceded lands of the Nacotchtank people. No living Nacotchtank remains due to displacement, dispossession, and death caused by the arrival of settler colonizers. Their survivors were adopted into the Piscataway Conoy people, but losing their original identity and descendancy. The modern city of Washington, D.C. was built in part through forced labor of enslaved people, and so opportunities and resources have been violently denied to generations of Black and Indigenous people. And these are the communities at greatest risk from the impacts of climate change and the threats that it causes to health. So we uplift and uphold their sovereignty, history, and experiences through our commitment to climate justice that centers Black and Indigenous people. And that's a big part of the reason that we're here today, is to drive that work forward and to make that connection between health equity and climate solutions. So we have our full agenda here. So we will be, it's a packed agenda. We have panels, speakers, we have structured breakout groups for you to share, strategize, and learn together. And we'll have multiple opportunities for you to connect with each other, learn from the other people in this room in both a structured and unstructured networking time. There's still coffee, food, hot water, and tea in that direction. Bathrooms, if you haven't seen, are through this door to the left down that hallway. And we'll have lunch at noon Eastern time. We're also joined by over 300 virtual participants that are online. So we do ask that you use the Demio platform. So this is a great tool we've sent out in all those emails that you've gotten throughout the day. Great way to connect with people. We'll be sending out poll questions, chats, resources directly on that platform. You can use it on your phone or your computer. You don't need to download an app. It's just directly in your browser. And this way you can connect with those hundreds of people who are joining online. And like I said, we'll be sending out those resources throughout the day. And for those of you online, we'll be listening to your comments. We have several members of staff monitoring those chats, engaging with you, and we'll be pulling those comments, questions out to the live speakers and to the live audience. So if you have time, we'll be making sure that you get a chance to connect into that Demio platform and chat with people. Oh, and when you do, just make sure that you mute the audio on your phone so that you're not broadcasting the audio and we have a good echo effect in here. So our goal today is to build momentum for climate solutions, and we're doing that through elevating your leadership. So we do want to make sure that we are doing that in a way that's inclusive, that makes sure that we hear from everyone's voices. So we just have a few of our values up here. I don't think this should be new to a lot of people, but we do want you to keep in mind throughout the day. You know, there's a lot of type A personalities in the health fields. So if you know that you tend to dominate conversations and have a lot to say, be aware of it, give space to other people, make sure that the folks who've been quiet all day have a chance to talk as well. We really do want to hear from everyone in the room. We've designed a lot of our activities today to make sure they have a chance to talk. And so we just ask you to also keep that in mind. And so, of course, we are extremely thankful to be hosted by the George Washington University Milken Institute School of Public Health. And I'm really proud now to be joined and welcome you with the Dean, Lynn Goldman. So Dean Goldman, your leadership, both in policy and academia, it's great to see you. As your leadership has helped to make all of us safer, make our food safer, reduce our exposure to toxins. And we're so proud that you're a member of the Climate for Health Executive Committee and has helped to shape all of our programs. So thank you so much, Dean Goldman.
Thank you. Thank you so much, Ben, and thanks so much to Eco America for holding this conference. And I will say first, a huge welcome to the Milken Institute School of Public Health. We are a proud partner of Eco America, and we're thrilled to have you here at our school, the only school of public health in the nation's capital. But most importantly, we're thankful to you for bringing people together at such an important time. One thing I know is I don't need to tell all of you about the public health consequences of climate change, the single biggest public health threat facing humanity. The impacts are already harming health through air pollution, disease, extreme weather events, forced displacement, food insecurity, and pressures on mental health. All of our efforts in public health to create healthier and safer communities everywhere could be swept away by climate-related diseases and disasters. Every year, directly and indirectly, climate and associated air pollution kills millions of people. More than 90% of people breathe unhealthy levels of air pollution, mainly from burning fuels that drive climate change. A single chemical reaction, one that we call fire, combining oxygen with a carbon-based fuel ignited by heat, has for eons provided humans with health, with heat, light, and most recently, electricity. We probably discovered fire a million years ago, guys. But it also produces carbon dioxide, as well as an array of air pollutants that are hazardous to our health. We humans have been doing this successfully for a very long time, but with 7.9 billion people on the planet relying on this one chemical reaction, we decades ago exceeded the Earth's capacity to be able to absorb all of the carbon dioxide that we produce, and it is harming us. Globally, this costs us an estimated $8 billion daily in health damages alone. Public health systems are the primary defense for populations who are facing emerging health threats. In order to protect the public's health and avoid widening health inequities, countries must build climate resilient communities and health systems. But whether we practice public health or we practice health care, we must go much further. We aren't running out of oil or coal anytime soon, folks. Far from it. So we must lead the way in switching to healthier alternatives for generating the energy we need. In other words, we have to stop burning things. We must stop activities that emit CO2, methane, and other harmful pollutants. This is a tall order, but here at GW, we are fortunate to have a world-class Climate and Health Institute headed by my brilliant colleague, Dr. Susan Annenberg. Susan, nice to see you. She and her colleagues and public health professionals like her across the country are working to understand the widespread impacts of health, air pollution, and climate change, and to promote equitable protection of population health at the local, national, and global levels. This work in our nation's capital is vital, as we as health professionals must also be climate and health advocates. We believe there's a need for one national health agenda on climate change around which all health professionals can take action. We have a moment, however brief, in which we can collectively act to stem the impacts of climate change. We must together use our research and resources to inform policies and policymakers to create evidence-based solutions to climate change. We thank EcoAmerica for doing the very good work of bringing us together so that we can share what we have learned and move forward more quickly. As we do so, I charge you, our guests, and EcoAmerica to please hold our most vulnerable neighbors in the forefront of our minds as we move through today's program. They need us to act together and act now, once and for all. Today, we can make a difference for people suffering and for all future generations. I hope you all enjoy your time here at GW. As you can hear, we're passionate about our work and grateful to all of you who have a desire to build an inclusive movement on climate solutions. It is now my great pleasure to bring to the stage Bob Perkowitz. Bob Perkowitz, not only the founder and I would say the mastermind behind this effort, a good friend, somebody who has been truly prescient in terms of, for many years, seeing the need to do this work. It's a great pleasure to have you with us here today, Bob.
Thank you. Thank you so much, Lynn. Lynn is more than just the dean of one of the nation's very best schools of public health. She's a renowned epidemiologist. She is a pediatrician, and she is a doctor of public health, of course. And deep down inside, she's a really, really good person. I've known Lynn for over 20 years, and she's wonderful.